Since the parameters I've set for my auricular therapy course and video doesn't seem to fit into any one professional classification, I've decided to promote a new trademark name and method called Auricular Therapy HP, or AHP for short. AHP stands for Auricular Therapy for Health and Prevention and is geared for the health professional that would like to integrate auricular therapy into their practice, and for any individual that would like to have a skill set that could help improve their health and the health of their friends and family. My background will help explain how AHP was created, and as I was first introduced to auricular therapy in 1999, where I met my master, Dr. Chun Huang, in a seminar she presented on auricular therapy at an acupuncture college in Los Angeles. I recognized that she was truly a pearl in the open seas, and made arrangements for her to use my office whenever she would visit Los Angeles for her seminars. I booked patients for her and had the opportunity to learn and study in the hands-on approach that has made me the professional I am today. I've mastered many healing art forms, and it is mostly under the guidance of an expert. The methods I've learned from Dr. Huang focuses on the use of auricular therapy for diagnosis and medical care. But my approach has never wavered from the philosophy I hold dear to my heart that has stood the test of time as a healthcare practitioner. And that is, the body has an innate intelligence, and what we do and think will shape our being. If we utilize natural healthcare modalities and methods, and participate in activities that maintain our health, we can age with power and grace. My intention with AHP is to share the medical methods I've learned from Dr. Huang and just shift the paradigm in the direction to health and wellness that will allow all of us to benefit from this incredible science and art form. AHP incorporates inspection, palpation, evaluation, and treatment. You will use the area approach to help demystify the ear charts and learn how easy it is to find most points on the ears. Palpation methods and treatment will include the use of a slide probe, auricular massage, and ear reflexology. We will introduce electrical point finders, but we will hold that topic for another presentation. Also, treatment will include the use of ear seeds that will allow your treatment to have truly lasting effects. If you are serious about using auricular therapy HP, you'll want to attend classes and learn all the options available, for we have just met on this exciting journey together, and I hope to see all of you soon. And if that's not our fortune to meet in person, then visit my web addresses and we will continue our travels together, healing one touch at a time. Welcome everybody to a great video on auricular therapy, and I first want to tell you a little bit of how this video came about. In 1999, I had the opportunity to meet a true master in auricular therapy. Her name is Dr. Chun Huang, and she's from China, but she lives here in the States right now, over in Orlando, Florida. And I had a great class with her. I recognized that she was an absolute master in this field, and I wanted to learn more from her. I had a conversation with Dr. Huang, and we agreed that when she came out to teach here on the West Coast, she would use my office as a home base. And I had the privilege of videotaping many, many hours of her doing her magic on my patients. The purpose of this video is to bring Dr. Huang's work to the public in a much bigger way. I hope this video can satisfy the layperson that wants to learn how to use a fantastic, magical type of natural healing art for themselves and their family, as well as the professional that would like to learn more about auricular therapy.
About Dr. Chun Huang's background information, she was originally training as a surgeon, and she is work for the PLA General Hospital. Because one day she has an injury in the middle of the finger. The middle of the ankle has an injury, so she was laid off 1 week. Not supposed to go inside the surgical room. Then she has time to rest for that 1 week. Somebody invite her to study the ear, acupuncture. So she beginning to ear acupuncture. In the very first time she treated a patient his shoulder trouble. She only used 2 fingers instead of the 5 fingers. She helped the first patient shoulder pain immediately get relief. So she find out this is very simple. How come we have to get into the surgery? She started interested in learn the auricular acupuncture, auricular therapy, and she become very interested and devote her time to get into this profession. Then she become learn the Chinese medicine, learn Chinese acupuncture, ear acupuncture. For there on, she became very devoted in the field of the auricular therapy. She find out this is very simple, quick, easy, can help the patient. So she decided to get into this profession. Okay. Originally, she did have a Chinese doctor. The name is called Dr. Wang Zhong.
Yes.
And he is specialized teaching the ear acupuncture. So from that time, she get into study from him. And Dr. Wang Zhong will be teaching her the auricular therapy. So from there on, she become very devoted, because this teacher, Dr. Wang Zhong, is one of the few Chinese doctors know the auricular therapy and ear acupuncture, because this is one special field. So she has a training by a doctor, but was in the hospital. In the hospital, they from time to time they have seminar and a teaching program, and she switch from the Western medicine go to the traditional Chinese medicine. The European system, Dr. Pathomorphology system, is very inspire all the Chinese doctors that the ear has an anatomy background, that the ear represents the whole body. So this make everybody in China very surprised, because they find out how come we don't have this scientific background information too. So all the Chinese university hospital especially, many of the acupuncturist people or people learn ear acupuncture, they start to learn the European system. So of course she got to study the European system before she can develop her own. So I believe at that time, during of the 1958, 1960, that time, European ear point only somewhere about 30 to 50 points. They study all of them. And they also do the research. She contact at least over 40, 50 research people. She conduct her research by herself. So she got a lot of case study. Like she studied the digestion system. She studied the acne problem. She studied the renal disease or scleroderma disease. Patient has trouble. She started to do the research of all this kind of a medical by her own patient. Now finally, she find out every disease she spent about over 500 patients to decide the ear point is correct. So her point she have 100% sure because she find out European point approximately 20% is not right because she used her patient to come in to do the research, you find it out too. So she become her own system. And she continue to develop not only auricular therapy, she developed a diagnosis technique that she can use the ear diagnose the disease. And this diagnosis today is become most influenced diagnosis technique in the world. She can in 1 minute's time, 5 minutes time, she can tell patient disease yes or no, or what kind of disease. She can in 30 minutes or 40 minutes time, she can do a whole body comprehensive physical examination. Commonly, Western doctor need 2 weeks, 2 month time. She only need 30 minutes, she will find this out. So this new system, new diagnosis is discovered by her research. Okay, so we have a called instant diagnosis, an instant treatment for the patient. So this diagnosis is very powerful, very important. I will encourage you, everybody need to learn this. And this diagnosis, number one, is called inspection diagnosis. Only look at the ear, you can tell approximately 100 disease without go to laboratory, without go to the big medical instrument to find out what the problem. Just ear will tell you over 100 disease. Secondly, her technique for the electrical, her technique for the touching technique, you can find out 200-300 different disease just by point finder, the skill, the technique she using. So she continue publish her book. Up to present time, because different languages, she published almost about 20 books in Auricular Medicine. And nobody, she got in the international conference in Puerto Rico, about 400 MD come from Europe, American, North, South, come from Oriental. In the presentation, she was named the #1 Lifetime Achievement Award. And that conference is an MD conference. And she was elected to be #1 in the world. So this is, she really have a very good, it's everything by her own. You can see in the bookstore, so many people write the book. You're going to find out that nobody has a comprehensive, detailed information that she got. Okay? So she can show the all this.
That is the book in Chinese?
This is in Chinese, right?
This is English.
This is in English book. Yeah. This is a Lifetime Achievement Award, 2002, in Puerto Rico. This is a government certificate given for expertise, particularly in the ear acupuncture. Government's expertise. This is her newest technique of the book. Okay, because of her background, she worked for a biggest hospital in China called PLA General Hospital. It's the biggest in China. So she has no problem to get patients. Every day she can have 50 to 200 patients for her research. So in 10-15 year time, she touches all the topic. She touches all the disease, condition. She has a volumes of the patient that nobody can get that chance. In Western world, if you want to do a research for one type of the disease, let's say duodenum also, she has no problem in 1 week. She can get 300 patients. But in this country, difficult. You know, you want to do one research of 300 patients, you have to wait for 3 years to get research data. But she has a good opportunities. Hospital is big, volume of the patient there, and from her background, the people willing to give to her patient because the patient, all the other doctors say, how many patients you need, we give it to you. So she can do so many research. That's why she get into so many research. Every patient, when she decide the point in this year point she decide, must be at least see 500 patients.
For each point?
Each point.
Wow.
So this background information is so important. We almost assure all this point is correct.
Yes.
Okay. Example, one time they call our office, say, I need to buy 2 more books from you. We asking him, why you buy one, need 2 more? He said, because I do research. There's a point who prostrate. I using the European point, I cannot find it. But when I use your point, I can get a report. Research come out. So I find out your point is most accurate. And your point also comprehensive. We can get the detail from there. So this is all by research background. And the background of the hospital, background of her study, Western and Eastern medicine. So she become know both of them. It's so important there.
Not only research frontal, anterior pointer, I research is posterior. Yeah. Right now it's a posterior is a ear point about is 36 point. I found it's ear point on the posterior as a treat back problem very treat as a musculoskeletal system is very effective because its ear anterior is a control frontal ear, frontal whole body, and the posterior is a control whole back.
The back.
If you treat is a musculoskeletal system, is for example, the treat cervical vertebra, is degeneration and treat the lower back and the sciatica. Only 2 triangle area, only 6 point can treat the whole back pain. Very effective.
As you know, the ear represents the whole body. So this ear actually is, generally speaking, is a whole body. First of all, we give you an example. This area, for example, called triangle fossa, is represent triangle fossa represent the reproductive system, medical system. Okay, this area is to represent the person's the lower abdomen area. Okay, this area is a thoracic area to represent the upper part of the body. The earlobe is represent the brain here, and all the 5 senses of the organ. Everything was surrounding in this area. Then this is the spinal area. Okay, represent patient's spine, and this represent the back area. And this area is upper limb. All this area, scapula area. The upper limb is always in this section. Go here to the finger. Then this is the lower limb area. Okay, lower limb from the hip to the knee, and go to the ankle, go to the bottom of the feet. So the whole body information is here from the musculoskeletal, back pain, back area is a problem, and in the head and the 5 senses of organ. So the whole body information follow this ear point. Approximately we have 300, usually we have 165 points. In addition of the diagram, total we have over 200 information. So we can diagnose as a 200 disease, 500 symptoms. Because each disease or each location of the part of the body, they have different type of the condition can be happen. So ear can diagnose more than 200 disease, 500 different symptoms. Everything in this ear, like the whole body. And Dr. Li Chun is the one developed this system. We are not only treat the patient, we can diagnose the disease at the same time. And this all comes from a personal research from last 35 years. Okay, so it actually is very valuable information. And she willing to share this information. She will lecture all over. And she will no reservation tell everybody how to do this system there. Dr. Chun Huang's Auricular Medicine has two important parts. One is diagnosis. And the diagnosis, she got 4 steps. Number 1 is called inspection diagnosis. Just look the ear, tell patient what disease. Secondly, is a touching diagnosis. She can use the point finder. Use this point finder or use the finger to touch the ear. She can tell what the problem is. Because this point finder attached to the electrical machine. And this pin is made very easy to operate. You touch it by using this point, touching the ear point, according to the responding of the sound, we can tell what level of the disease and what location of the disease. Okay, so her electrical diagnosis and her touching diagnosis, her inspection diagnosis, combined information, she can differentiate disease. Where is the disease? What stage? What condition of the disease? Usually, if it's one single disease or problem, she can tell within 1 minute's time. If it's a whole system, she can tell in 5 minutes' time. And the ear has a 14 medical system. She designed that way. You just follow the diagram, from the ear, and she can learn this 14 medical system. You can treat the endocrine system, immune system, gynecology system, reproductive system, musculoskeletal system, nerve system, etc., etc. Total 14 medical system. Everything is in the ear. This is a diagram we show it to you. The diagram is represent 14 medical system in the body. So it's very easy to learn. You just follow this diagram. The point all show up down there, and you can treat the patient. Follow this. Now the method she used the treatment is very simple. Number 1 is she using called point treatment. She don't like to use a needle because the needle people resent. She developed a new system called ear seed treatment. Is put the seed in the ear point, and there's a band-aid on the top there.
Yes.
Okay. So she using the seed to replace the needle, and this become more effective than needle. You know why? It's because this seed keep with the patient ear for 1 week time, and during the 1 week, patient can treat themselves. They press the seed just like they get a treatment. So making this treatment long last and more effect, better than needle in and out.